Hey, welcome. Let's talk about a part of the body we almost never think about until something goes wrong, the neck. It's so much more than just the thing holding your head up. It's this incredible, bustling hub of absolutely critical, life-sustaining functions.
I mean, just think about that for a second. It's a terrifying thought, right? When any of those things happen, the neck suddenly becomes the absolute center of the universe for medical teams. Everything, the air you breathe, the words you speak, the blood that fuels your every thought, it all has to pass through this one narrow corridor.
So, that's what we're diving into today. We're going to pull back the curtain on some of the incredible medical interventions designed to protect this vital crossroads. We'll look at everything from split-second emergency actions to delicate, planned surgeries that all happen in this one amazingly complex area.
Okay, let's start with the most urgent crisis you can imagine, a blocked airway. When someone can't breathe, you don't have minutes, you have seconds. Every single one is critical.
This is where a procedure called a cricothyrotomy comes into play. You know, in those extreme high-stakes emergencies like severe trauma or swelling where you just can't get a breathing tube in the normal way. This is the fastest way to get air into the lungs. It's a direct, no-messing-around intervention to get someone breathing again. Now, a lot of people mix this up with a tracheostomy, but they are fundamentally different. And as you can see here, the key difference really boils down to one thing: speed. A cricothyrotomy is all about getting an airway open right now. A tracheostomy, on the other hand, is more invasive, it's more of a planned surgery, often done later once the immediate crisis is over.
All right, look at this. Just one number, 10%. On its own, it means absolutely nothing. But inside the incredibly crowded anatomy of the neck, this 10% represents a hidden curveball that surgeons always have to be ready for.
And here's what it's all about. In about 1 out of every 10 people, there's this little extra artery called the thyroid artery. It's an anatomical variation. It's not supposed to be there, but when it is, it runs right down the middle of the windpipe. And surgeons have to know about this, because if you're not careful, it can be a source of major bleeding during any procedure in that area.
Okay, so moving on from emergency airways, let's take a look at how doctors actually examined the source of your voice, the larynx, or, as we all know it, the voice box.
The procedure for this is called a laryngoscopy, and it does pretty much what it sounds like. It gives doctors a direct visual look inside your throat to check out the very structures that let you speak, sing, and shout.
Now, there are basically two ways to do this. The indirect method is kind of old school, using a simple mirror to get a basic view. The direct method, though, is much more modern. It uses a laryngoscope, which is a flexible, lighted tube to get a way more detailed, up-close and illuminated view of everything in there. So what are they looking for? Well, in a healthy larynx, they expect to see some very specific colors. The vestibular folds, which are kind of like a protective layer, should look pink. But the actual vocal folds, the parts that vibrate to make sound, they should appear a really distinct pearly white.
Next up, we're going to dive even deeper into the neck to find some tiny but unbelievably important glands that are just tucked away right behind the thyroid.
And this brings us to a procedure with a bit of a mouthful of a name, a parathyroidectomy. But the name itself actually gives us a pretty good clue about what it is.
Yep, it's the surgical removal of one or more of these parathyroid glands. These little guys are responsible for regulating calcium in your body. So if they develop a tumor or start going into overdrive and producing too many hormones, a surgeon might have to go in and remove the one that's causing the trouble.
But this surgery isn't a walk in the park. Because of how incredibly crowded the real estate is in the neck, there are real risks. The nerves that control your voice box run right past these glands, so there's a chance of hoarseness. And because you're removing a gland that controls calcium, the ones that are left behind can get kind of stunned, which can lead to temporarily low calcium levels.
All right, for our last section, let's talk about the absolute superhighway of the neck, the carotid artery. This is the pipeline carrying freshly oxygenated blood straight to your brain. And we're actually going to make this one a little interactive, so you can really connect with this vital structure yourself.
Go ahead, try this with me right now. First, gently find your voice box, your Adam's apple, right there in the center of your throat, okay? Now, feel for that big strap-like muscle on the side of your neck. Now take 2 fingers and place them in that soft groove right between those 2 spots. You might have to slide your fingers up or down just a little bit. Now just press in gently. That strong, steady thump you feel? That's it. That's your carotid artery, the vital superhighway pumping blood to your brain.
And that really brings us to the main takeaway here. From emergency airways to tiny glands and these massive arteries, Everything is packed into this one small, delicate space. The sheer complexity of the neck is just a perfect example of why medicine requires such incredible knowledge, skill, and just unbelievable precision.
It really makes you think, doesn't it? The neck is just one small part of your body. Imagine all the other hidden marvels, all the other intricate systems that are working perfectly inside you, right now, just to keep you alive. Pretty amazing. Thanks for joining me.